Hey, Dr. Willis here from Advanced Functional Medicine in San Diego. Sort of random thought here. I read an article recently by the National Institute of Health that talked about statistically between 1920 and 1940, there was approximately 7.5% of the U.S. adult population that was living with a chronic disease. Now, chronic disease being defined as cardiovascular disease, autoimmunity, cancer, Alzheimer's disease, obesity, mental health issues, etc. And I think we can all agree since the early 1900s, obviously, we didn't have access to healthcare as much as we do now. Certainly the pharmaceuticals weren't really around like they are now, or even a lot of the medical technologies, access to hospitals, etc. But you fast forward, and then in 2020, that same statistic revealed that 60% of the U.S. adult population was living with a chronic disease. 60%. That's 6 out of every 10. That's an 800% increase since World War II, essentially. So the question is, why? With all the advances in technologies and all the new pharmaceuticals that we have, you would think chronic disease would be eradicated by now, but it isn't. It's gotten exponentially worse. So what we're doing is obviously not helping. Masking symptoms with drugs is not helping. So this is why functional medicine is so effective, because it's always been about root cause. We step away from that conventional model to dig deep into the body to uncover what's driving a process. And I could tell you, with all the exposure to things now that we didn't have in World War II, essentially the pesticides, the insecticides, the herbicides, the fungicides, the plasticides that we're exposed to, the processed foods, the chemicals, the high fructose corn syrup and food color, food dyes, shelf life enhancers. All the chemicals that we're ingesting in our body, the genetic modification of food, the air quality, water quality obviously has changed, and we're just slowly poisoning ourselves. And there isn't a pharmaceutical on the planet that's going to do anything about it at all. We really have to find a better way, a better path, and that's what functional medicine provides patients. And I've seen people that have had cardiovascular disease, they have autoimmunity, diabetes, thyroid issues, hormone problems, memory that is starting to go. And once we run their tests and get them on a pathway or a roadmap that suits their body and their physiology, they start coming out of it. Surprise, right? So we have to open our eyes to this. We really have to focus on this. We have to make changes on the conventional level. Insurance companies, yes, they've adopted that drug therapy model, but they did it only for reasons of financial reasons. That was it. It makes good money, and you can see a patient in a couple of minutes. You walk in, you listen to symptoms, you prescribe a drug, they go away, the next one comes in. So I'm hoping that this reaches enough people to sort of open your eyes and know that there's better ways out there. There are truer answers if you look for them.
Look better, feel better, function better. Advanced Functional Medicine.